Okay, the last part of our lecture for pregnancy is about prenatal care. Okay? Ang prenatal care, its major goal is to make sure that the mommy and the baby is healthy. We have to ensure that the birth of a healthy baby is there and there is minimal risk for the mother too. Okay? Ang tanong, kailan dapat magpa-prenatal care ang babae? As long as once the mother suspects or learns she is pregnant, she should immediately seek prenatal care. According to EINC, if the pregnancy is healthy, 4 is enough. 4 prenatal check-ups are enough. Syempre, it is increased if there are complications. Okay? Now, what are the components to achieve that the major goal of prenatal care is being achieved? First, dapat we get thorough assessment. This assessment is knowing the history of the mommy. This assessment includes doing physical exam, and this assessment also includes doing laboratory tests. Second is to make sure that there is proper nutrition. Okay? Ang buntis na babae, nagdo-double yung recommended daily allowance niya during pregnancy. RDA doubles during pregnancy, which means that hindi lang siya kumakain for herself but also for her baby. Third is to make sure that the fetal well-being is ensured. Healthy baby inside. And last, you prepare for birth. Okay, yung pag nagle-labor na siya at pagpapaanak sa kanya. Now, in taking thorough assessment, ito yung mga kailangan nating makuha at alamin during the first pregnancy visit. First check-up. So, health history. You have to interview the mother. Do physical exam from head to toe assessment. Like yung pelvic exam, yan yung medyo kakaiba dyan from your HA. So you have to recall HA. I will not discuss this further kasi HA ito. Pero yung pelvic exam, this is important during first pregnancy kasi kailangang ma-measure kung ang sipit-sipitan ng nanay ay normal ang size. Kasi kung hindi, baka mahirapan ang vaginal birth at kailangan siyang manganak ng CS. Alright, again, pelvic exam is important. First pregnancy visit, first pregnancy. Yung succeeding pregnancies, may idea ng yung doktor, so hindi na kailangan yung pelvic exam. Okay? Otherwise, kung kailangan lang talaga ulit i-check. Okay? Laboratory tests, you check the blood, you check urinalysis, tas may ibang mga routine test, that can help determine how well the pregnancy is, how well the mother and the baby is. Okay? Ngayon, continuing prenatal visits, syempre interview pa rin, may physical exam pa din, tapos yung mga tests, yung mga routine tests, tapos syempre, chine-check na rin yung kumusta si baby, ano yung progress niya. Fetal heart rate, fundic height, naramdaman na ba yung gumalaw na baby, at yung mga ultrasound. Okay? Continuous assessment dapat. The second one is achieving proper nutrition in pregnancy. Please take note of the recommended weight gain and breakdown. Yung discuss natin kanina na 25 to 35 pounds at yung normal breakdown noon, 1 pound per month, first trimester, 1 pound per week, second and third trimester. Okay, first, ang protein needs nag-increase, carbohydrates, importante to provide energy. The fat should not exceed 30% of daily intake. Low fat dapat. Calcium needs is important. Iron needs should increase, including folic acid. Folic acid is vitamin B9. Importante siya to prevent neural tube defects. When you say neural tube defects, problems involving the brain and the spinal cord formation. Okay? A pregnant woman should avoid caffeine as much as possible, pero may mga tao kasi o babae na mas hindi nakaka-function pag hindi nag-coffee. But if that's the case, limited to 300 mg per day. Additives, preservatives, or artificial sweeteners should be avoided. These can cross the placenta and may harm the baby. Ang alcohol is definitely not allowed. Alcohol is good for the heart na normal amount, no, limited amount. But in pregnancy, there is no accepted level of alcohol in the body. Alcohol always crosses the placenta. And if it crosses the placenta, it can reflect damage dun sa baby's nervous system. Okay? And it can also cause fetal alcohol syndrome. Okay? Anyway, that's another topic also sa MCN2, which is already a complication or high-risk pregnancy. Next is ensuring fetal well-being. So, ito yung mga test na ginagawa sa fetus. Ultrasound, amniocentesis, non-stress test, contraction stress test, and the fetal biophysical profile. Let's discuss them one by one. Ang ultrasound diagnoses pregnancy as early as 6 weeks, pwede. It can also confirm presence, size, location of placenta and amniotic fluid. Also, pwede rin malaman dito kung yung fetus ba ay lumalaki. Wala bang gross abnormalities such as hydrocephalus, anencephaly. Pag sinabing anencephaly, no, yung baby walang na-form na brain, spinal cord, heart, kidney, and bladder defects. Ultrasound can also detect sex, especially if a penis is detected or revealed. Okay? Another is to establish the presentation and position. Ulo ba yung nandun sa vaginal opening, shoulders ba, or buttocks ba? No? And also, it can predict maturity by measuring the fetal head. Now, ang ultrasound na nakikita nyo dito sa picture is just in the abdomen. It's an abdominal ultrasound. Pero merong intravaginal or intrarectal ultrasound. It is not necessary for routine testing in pregnancy. Okay? Now, nursing responsibility. Teach woman to drink a full glass of water every 15 minutes, beginning 90 minutes before the procedure and not void until after the procedure. Kailangan full bladder ang buntis pag nagpapa-ultrasound. A full bladder will reflect the best sound waves. Also, kapag full bladder, na-hold stable yung uterus habang in-ultrasound. Second responsibility, you have to place towel under the right buttocks to tip the body slightly so that the uterus will roll away from the vena cava. We have discussed a while ago that we have to prevent supine hypotension syndrome. By doing this, sa babae nagpapa-ultrasound, mape-prevent yung lightheadedness, fainting, o yung mararamdaman niya na supine hypotension syndrome. Okay? So, ito yung example ng ultrasound results, no? The first photo, medyo malabo, but now, mas malilinaw na yung mga ultrasound. Meron ng mga 3-dimensional, 4-dimensional, na kitang-kita mo yung features ng baby. Okay? Mas advanced machines to use. Another test is amniocentesis. Amniotic fluid is extracted usually between 14 to 16 weeks AOG. Anong purpose ng amniocentesis? For chromosomal analysis, especially pag may genetic diseases. Amniocentesis can also determine AFP or alpha-fetoprotein. It is increased for an open body defect such as yung binanggit ko nga na neural tube defect, no? Yung mga problems sa brain and spinal cord, mga open defects yan. Naka-protrude yung meninges, no? Omphalocele, nakalabas yung gastrointestinal organs. It is also decreased with chromosome defects such as Down syndrome. Down syndrome is trisomy 21, yun yung mongoloid. Also, it can detect blood incompatibility such as RH. It can detect infection. And it can also detect fetal lung maturity. I mentioned a while ago the LS ratio, lecithin sphingomyelin. Initially, 1:2 yan. Pero pag yung LS ratio ay 2:1 na, no, the fetal lungs suggests maturity. Kakayanin na niya yung extrauterine life. Lecithin sphingomyelin is actually the protein component of the surfactant in the alveoli. Again, surfactant prevents alveolar surface tension during expiration para ma-prevent yung lung collapse or atelectasis. At ang risk ng respiratory distress ay para sa mga pinapanganak ng kulang dito, which are those na born premature. Okay? Ito yung procedure ng amniocentesis. So, may local anesthetic. As you can see in the photo, ini-insert siya in order to relieve pain felt. Second, pag may effect na yung local anesthetic, a needle is inserted through the abdominal wall, through and through the uterus, through and through the amniotic fluid. Siyempre, no, kailangan may guide ng ultrasound machine. A physician will puncture the sac in an area away from the fetus. And then i-extract around 20 ml of amniotic fluid. So, as you can see in the photo, dapat maingat na hindi mapapuncture si baby. Okay? After the extraction, dadali na yung amniotic fluid sa laboratory to test under the microscope kung ano yung indication ng amniocentesis. In regard to the fetus, the puncture will heal and the amniotic fluid will be replaced kasi nandun pa naman yung amnion. Diba? The amnion produces amniotic fluid. It's still there. Na-puncture lang siya. It will be replenished and it will heal over the next 24 to 48 hours. Okay? Again, sa amniocentesis, nakahiga yung mommy. Dito, kailangan makaihi naman. Ask the mother to void. Plus, ask the mother to put or assist the mother na lagyan ulit ng towel under the right buttocks. This is for prevention of supine hypotension syndrome. Okay, that's another picture. Okay, the third test is a non-stress test. It's a screening test used to monitor the fetal heart rate in response to movement. Tayo pag gumagalaw, anong nangyayari sa ating fetal heart rate? Normally, magi-increase. Ganon din dapat yung baby. Baby moving aside should have an increased heart rate. Alright? In response to movement. The machine used here is called a cardiotachograph. The premise is a well-oxygenated, non-acidemic fetus will spontaneously have temporary increases in the fetal heart rate. When the fetus moves, fetal heart rate should increase about 15 beats per minute and remain elevated for the next 15 seconds. No? It should decrease to average again as the fetus quiets down. Okay? Ano ba ang normal fetal heart rate? It's 120 to 160. So, nandun yung baseline. 120 to 160. Dapat, pag gumagalaw yung fetus, may 15 beats per minute increase for about 15 seconds. Pag yun ang nakikita sa non-stress test, it's a good result. The baby is well oxygenated at wala siyang fetal acidosis. Yun yung premise. If there is no increase in beats per minute on fetal movement, it is suggested na baka merong poor oxygen perfusion to the fetus. So further tests should be done. Okay. Ano yung result? Ang result, you can simply interpret it as reactive or non-reactive. Reactive is normal, non-reactive is abnormal. So again, yun yung tachograph machine. Minomonitor ng machine ang galaw ng baby. Pag gumalaw ang baby, imomonitor ang fetal heart rate niya. If the result is reactive or normal, there are 2 or more fetal heart rate accelerations. Again, gaano kataas yung in-increase? At least 15. Gaano katagal? At least 15-minute duration. Gaano kataas yung tinaas? At least 15 beats per minute. At gaano katagal yung duration nung pagtaas na yon? At least 15 seconds after a fetal movement. Ang tanong, gaano katagal hihintayin yan? It's within a 10 to 20 minute period. So pag ang babae magna-non-stress test, sasabihan mo siya na nakahiga siya hanggang at least 20 minutes to achieve the results. Again, dahil nakahiga, baka mamaya mag-supine hypotension syndrome. So kailangan merong towel ulit sa right buttocks, tapos paihiin ulit yung nanay. Okay, dapat yung bladder is empty, no, para relax. Non-reactive yung result or abnormal siya if there are no fetal movements or there is low or short-term fetal heart rate variability, meaning hindi na-achieve yung criteria ng reactive. Okay? Now, minsan, hindi naman agad na non-reactive, may problema agad yung fetus. Baka mamaya yung fetus tulog. Okay? Baka hindi siya gising, tulog siya kaya hindi siya gumagalaw doon sa 20-minute period na yon. That's why wala ring fetal heart rate accelerations kasi naka-relax lang yung fetus. So, what we can do is, one, is to give the mother an oral carbohydrate snack. No? Pakainin mo yung nanay, ma-stimulate yung baby noon, pwede siyang magising. Or, pwede rin ang vibroacoustic stimulation. No? Yung vibroacoustic stimulation, making use of a bell or a machine, i-ring mo yun, maririnig siya ng fetus, pwede siyang magising. It can speed up the test or it can actually further evaluate a non-reactive, non-stress test. Alright? So, pag na-determine mo nagising na yung fetus, syempre gagalaw na siya, mag-intay ka ulit ng 10 to 20 minute period to reach the criteria and be able to interpret results as reactive or normal. Okay? Another test is a contraction stress test. Now, ang contraction stress test naman, it is performed near the end of the pregnancy. What is the purpose? You want to determine how well the fetus can cope with the contractions of childbirth. Ang labor ay accompanied by uterine contractions, and contractions slow blood flow to the fetus. Hindi naman mabilis ang labor. May labor na nangyayari ng isang araw, kalahating araw nagle-labor yung nanay. And every time naghihilab yung tiyan, konti din ang blood flow na napupunta kay baby. So yung contraction stress test, pwede determine kung kakayanin ba ng baby na yan yung stress of labor. Okay? Siyempre, ang aim mo sa test na ito ay ma-induce ang contraction. At pag na-induce yung contraction sa mommy na itetest mo, imo-monitor mo ngayon yung fetus and again, you check the heart rate. You use also a cardiotocograph. Now, fetal heart rate is analyzed here in conjunction with contractions. Dun sa non-stress test, sinecheck natin ang fetal heart rate with every movement. At ano dapat ang mangyari sa fetal heart rate? Mag-increase. Dito naman sa contraction stress test, we are checking fetal heart rate in conjunction with the uterine contraction. So again, nabanggit ko nga, ang unang dapat mangyari dyan, ma-induce yung contraction. Paano ma-induce yung contraction doon sa mommy? One possible way is nipple stimulation. Okay? When you stimulate the nipples, mag-stimulate din ang release ng oxytocin from the posterior pituitary gland. And oxytocin's target organ is the uterus for it to contract. Okay? The nurse instructs the patient on the procedure. One nipple is massaged gently until a contraction begins. For 2 minutes, is-stimulate ang nipple. How will you know na enough na yung contraction para magawa yung test? Dapat merong at least 3 contractions, 40 seconds in 10 minutes. Okay? So, dapat there is at least 3 contractions with a duration of 40 seconds in 10 minutes. If it is not achieved, pahinga muna, 5 minutes, other nipple is stimulated. Okay? Pag wala talaga, hindi na-stimulate yung uterine contraction at hindi na-achieve yung at least 3 contractions, 40 seconds in duration in 10 minutes, pwedeng magbigay ng OCT or pwedeng gawin yung OCT. It's the Oxytocin Challenge Test. Magbibigay ng oxytocin drug. Okay? It's an IV injection of exogenous oxytocin. Ano ulit yung target? Ganun ulit. 3 contractions in 10 minutes. Yung duration at least 40 seconds. Kasi yan yung actual na dalas, tagal, intensity ng contraction pag labor. Okay, na-achieve na ngayon yung uterine contraction. This is a uterine contraction. This is actually further discussed in labor and delivery, pero let's have a brief introduction here. This one pink curve line is one contraction. This straight pink line is relaxation of the uterus. And another curving, start of another contraction. So, one contraction, one relaxation. Okay? Isa itong uterine contraction, humihilab ang tiyan, tapos naka-relax. Ang duration ng contraction, dapat matagal for effective birth to occur. It should be at least more than 40 but should not exceed 60 to 90 seconds. Hanggang dyan lang yung kaya ng baby. Pag sobra-sobra na sa 60 to 90 seconds, magkakaroon na siya ng respiratory distress. Hindi niya kakayanin yung sobrang pagsikip ng blood vessels and insufficient blood flow. Kaya nga dapat may relaxation after a contraction para bumalik ulit yung magandang blood flow papunta ng fetus, which is about 2 to 3 minutes relaxation. Yung frequency, pag sinabing frequency, yung umpisa ng contraction sa umpisa ulit ng isa pang contraction. So, every 3 to 4 minutes or 3 in 10 minutes. Pero pag duration, start ng contraction to the end of that contraction. Alright? Now, ito ulit yung isang contraction. Increment means nag-uumpisa yung contraction. Acme, peak yung contraction. And decrement, patapos na yung contraction. Alright? So again, frequency is every 3 to 4 minutes or 3 to 4 in 10 minutes. Dapat relax in between. Frequency is the beginning of one contraction to the beginning of the second contraction or another contraction. Duration is 40 to 90 seconds. Pag sinabing duration is the beginning of contraction to the end of that contraction. Yan yung maximum contraction that a fetus can tolerate, not more than that. Pag less than that naman, baka hindi mairi ng maayos at mailabas yung baby. Okay? Ngayon, let us now try to look at this photo. Kapag kasi humihilab yung tiyan ng nanay, sa umpisa ng contraction, naiipit talaga yung ulo, the fetal head. So sa increment, at the start of a contraction, naiipit yung fetal head. Inside the head is vagus nerve or cranial nerve number 10. And that cranial nerve controls the heart rate. At dahil naiipit siya sa umpisa ng contraction, there is normal head compression, there is normal decrease in the fetal heart rate. We call that early deceleration. Okay? Ang early deceleration, from the word decelerate, bumababa yung fetal heart rate. Pero, tandaan nyo, kahit bumababa yung fetal heart rate, the level should still be between 120 to 160. I mean the range. 120 to 160 pa rin. Usually kasi ang normal range niyan, 130s, 140s, 150s. Okay? So, bumababa siya sa umpisa ng contraction, kaya early, which is increment, pero hindi pa rin dapat less than 120. So, yun yung normal. It's early. Okay? Ang reason, naiipit yung head sa increment. Andun yung cranial nerve number 10, vagus nerve, nako-compress, it controls heart rate, so fetal heart rate decreases. Okay? Another is the case naman na naiipit yung placenta or the myometrium blood vessels. Pag yun naman yung naiipit, obviously, it's not normal. O kaya pag yun naman yung nako-compromise, the placenta or the myometrium, it's not normal. Hindi siya pwedeng ma-compromise, especially the placenta. When that happens, meron namang late deceleration. Pag sinabing late deceleration, bumababa yung fetal heart rate during decrement. Sa decrement, dapat normal pa rin ang heart rate at babalik na nga siya dun sa normal level niya kasi malapit na ulit yung period ng relaxation. So, late deceleration, from the word late, bumababa yung heart rate, late in a contraction, which is in decrement and it is not normal. Ibig sabihin, yung placenta or yung myometrium blood flow nako-compress or nako-compromise. Another deceleration is the variable. Sino naman ang nako-compress dyan? Umbilical cord. Pwedeng yun naman yung naiipit. From the word variable, nagbababa yung heart rate not at the start of a contraction, not at the end of the contraction, but it could be in the middle of a contraction or even during relaxation. Kaya siya variable. Okay? Again, it is not normal kasi hindi pwedeng maipit yung umbilical cord dahil nandiyan yung daanan na oxygenated blood and unoxygenated blood to and from the baby and the fetus. I mean, the baby or the fetus and the placenta. Okay? Ngayon, hindi ulit normal ang variable deceleration. Itong dalawang ito, late and variable deceleration, immediate intervention is to change the woman's position. Preferably, again, left side lying or other position that would tell you na nababawasan yung pagkaipit ng umbilical cord or nababawasan yung pagkaipit ng placenta. Okay, yun yung goal mo. Alin lang dyan ang normal early deceleration. So, yun ngayon yung hinahanap natin pag contraction stress test. Na-achieve mo na yung uterine contraction eh. Meron ka ng duration na 40 to 90 seconds. Nakikita mo na yung contraction every 3 to 4 minutes. Okay? Aalamin mo ngayon kung ang nakikita mo na pagbaba ng heart rate ay early, variable, or late. Okay? How do you now interpret yung pagbaba ng heart rate? May nakikita ba akong early deceleration? Bumababa ba yung heart rate niya at the start? May nakikita ba akong late deceleration? Bumababa ba yung heart rate niya at the end of a contraction or variable deceleration? Okay, to interpret that, positive or negative. Pag positive, definitely may late or variable deceleration. Positive is abnormal. Pero pag ang result ay negative, walang late, walang variable deceleration. So, ano lang ang pwede mong makita dyan? Yung early deceleration. Negative interpretation is normal. Okay? So, pag ang nakita mo, pag ang result mo negative, kakayanin ng babying ito yung mag-labor. Pero pag positive yung result, hindi kakayanin ng baby yung mag-labor, baka kailangan niya ng cesarean section. Okay, last is the fetal biophysical profile. This profile scoring is more accurate in predicting fetal well-being than any single assessment. So, ang chine-check dito, fetal breathing, fetal movement, fetal tone, amniotic fluid, no? Tsaka yung fetal heart reactivity. Gaano ito katagal ginagawa? May ultrasound siya at may non-stress test. So, yun yung gagawin sa nanay. So, yung fetal breathing, no, at least 1 episode of sustained fetal breathing movements within 30 minutes of observation. So, yun yung criteria. Dapat gumalaw ng at least isang beses na may 30-second movement yung baby in a span of 30 minutes. So, 2 points siya doon. Yung fetal movement naman, no, at least 3 times siya na gumalaw within 30 minutes. 2 points siya doon. Yung fetal tone, no, at least mag-extend or mag-flex yung kamay niya at least once in 30 minutes. So, 2 points ulit siya doon. Yung amniotic fluid volume, no, minimeasure yung range ng amniotic fluid, minimeasure yun sa ultrasound. So, if it is between 5 to 25 cm, 2 points siya doon. So, gaano katagal ang ultrasound to measure these 4 sa fetal biophysical profile? At least 30 minutes. Another test, pag fetal biophysical profile, is the non-stress test. So, gaano nga katagal yung non-stress test? Yun naman yung 20 minutes. You check fetal heart rate increase, no, and yung duration with every fetal movement. So, 2 points ulit yon kapag ang result niya is reactive. So, total score is 10. If the score is about 8 to 10, it means the fetus is doing well. Kung ang score ng fetal biophysical profile ay nasa 6 lang, suspicious, no? Baka may problema kay fetus, check further. And then kapag 4, lalo na yung 4 and below, it denotes jeopardy. Baka may fetal distress, may problem si fetus. Okay? Last, sa ating prenatal care is preparing for effective childbirth. So, tinuturo natin dapat ang iba-ibang prenatal exercises. Okay, these are the different prenatal exercises. Yung TAILOR sitting. That's the photo. Para siyang modified Indian sit. It stretches perineum and the blood supply to the lower legs is not occluded. It's good position to use pag nanonood ng TV, nagbabasa, nakikipagkwentuhan. Do this 15 minutes every day. Ano ang advantage pag in-exercise mo yung perineum muscles? Kasi nasa-stretch yung perineum. Nape-prevent yung laceration. Okay? Which means na hindi napupunit yung puwerta with vaginal birth. Ngayon, kung halimbawa naman na may laceration o kaya ginupit talaga, episiotomy, meron pa ring advantage ang pag-stretch ng perineum ng buntis kasi bumibilis ang paghilom ng sugat kung nung buntis pa lang na-exercise na or na-stretch na yung perineum. Faster wound healing in the perineal area. Another is squatting, the same purpose, no? Stretches perineal muscles. Again, advantage, lesser chances ng laceration, pero pag meron talagang wound na, faster healing in the postpartum period. Third is pelvic tilt. Ito ay pwedeng gawin ng nakadapa or nakatihaya as shown in the photo. Tapos yan yung parang nag-o-8-8 ka. You pump. So, parang pump, no? 1, 2, 3, 4. Okay? Para nare-relieve yung backache. It makes the lumbar spine more flexible. Best to perform at the end of the day, lalo na pag masakit na yung likod ng buntis. Alright? So, ito, yung first photo, wala lang kasing movement. So, taas, baba, taas, baba. Ito din, ganon. Taas, baba, taas, baba. Okay? So, yun yung pelvic tilt exercise. KEGEL'S exercise is done during the course of daily activities while sitting, working around the house. Again, ang purpose nito, strengthen the muscles of the perineum. Okay, ang KEGEL'S exercise, paano yan ginagawa? Para kang nagpipigil ng ihi. So, parang kinokontract mo yung pelvic floor muscles. Alright? Contraction. Again, kung iyan ay na-exercise mo, kamukha ng mga unang exercises kanina that strengthens the perineal muscles, lesser chances of laceration, plus it's written here, helpful in the postpartum period healing. Also, it increases sexual responsiveness and also prevents stress incontinence. Yung tipong may tumutulong ihi na hindi mo makontrol. Okay? Pag magkaroon man ng ganong komplikasyon or problems, pagkapanganak. Abdominal muscle contractions is a modified sit-up. Okay? Modified siya kasi syempre someone should help the pregnant woman hold the foot down. So, pwedeng may pumipigil dito para makapag-sit up siya. Plus, hindi naman kailangan umabot yung sit-up niya hanggang tuhod. It strengthens abdominal muscles. Okay? Pag malakas yung abdominal muscle, napakarami niyang benefit. Una, it can contribute to effective second stage pushing, pag-ire. Pag pushing, ibig sabihin, umiire yung nanay. At yung pag-ire niya, magaling kasi malakas yung abdominal muscles niya para mabilis niyang mailabas yung baby. Kaya, second stage, kasi second stage of labor, pwedeng mag-push. We'll further discuss that in labor and delivery. Okay, doon pwedeng umire sa second stage pushing. So, magaling umire pag pinapractice yung abdominal muscles ng buntis. Another, restore abdominal tone after delivery. So, pagtapos manganak, mabilis liliit ulit yung tiyan. And third, prevent constipation kung na-exercise yung abdominal muscle contraction. And constipation, again, is common sa pregnant, also in the postpartum. Okay? And last is yung different breathing techniques. So, 1, 2, 3, and 4, iba-ibang klaseng breathing techniques yan. Yung number 5, ang importante to teach during labor. Breathing to prevent pushing. Meron kasing mga nanay, iring-iri na, pero wala pa sa second stage of labor. Okay? Anyway, we will further discuss that sa labor and delivery, pero pag hindi pa dapat umire or hindi pa dapat push, tinuturo yung breathing to prevent pushing. Hindi po pwedeng umire kasi pag umire, baka magkaroon ng laceration sa cervical canal. No, hindi pa kasi fully dilated ang cervix. So kung ganon, pero sabi ng nanay na iiri na siya, pero hindi pa siya fully dilated, we have to teach breathing to prevent pushing. You blow on each exhale. So inhale, and then pag exhale, so blow. So tuturuan mo yung ganon ng nanay if naiiri na siya pero hindi pa dapat umire. And then yung types of breathing 1 to 4, these are just the different types of breathing. So you just read through it. It's self-explanatory to help relax. No? During pregnancy, during delivery, and even postpartum. Okay, that's the end of our pregnancy discussion. It's a long topic that you have to study. Aralin ng mabuti, review, and you can also read the corresponding chapters in the book, Military, further to help you understand more about the different healthy or concepts of normal pregnancy. Okay, thank you.